All right, in today's show, we're going to be talking to Dr. Golie from Hawaii. So we're pretty excited to bring her on. And we're going to be talking about how leaky gut is associated with your dry eye. And we're going to be diving deep into this subject because Dr. Golie has a similar story to us. And so I'm really interested to hear her story and really dive into it. And I think you guys are going to get a lot from this show. So Dr. Golie, welcome to the show.
Thank you, Dr. Travis. It's so nice to be here. I appreciate you having me, and I'm grateful to be here. I'm excited about this topic. So
yeah, this is going to be a great conversation, and I'm excited to have you on. But before we get started on talking about leaky gut, just tell viewers a little bit about who you are, where you're from, and then what you do for a living.
Sure. Hi, aloha. I'm Dr. Golie Keovan, Dr. Golie Keovan, and I'm an integrative functional medicine eye doctor from Chicago. I am a co-owner with my husband, Leaky Keovan, of Belmont Eye Care in Chicago on Belmont Avenue and Ashland Eye Care in Chicago on Ashland Avenue, and also the CEO of the Nurturing the Soul supplement and product line. I'm so grateful to be here today. Thank you for having me.
Yeah, this is great. So let's dive into your backstory just a little bit. What made you become an eye doctor and then pursue that interest in dry eye itself?
Sure. Well, I always had a passion for science, and myself growing up as a Persian American, there were many times where when I did eat properly with my mom and dad feeding me, my health was great. And then when I went off to college and I ate differently and I, had different lifestyle changes, I noticed that my health started to degrade. And that's really in Loyola when I decided that I love science, but I think I want to pursue something in the medical field, potentially to be a medical doctor. Optometry came a little bit later, mostly because I alluded that I'm married to my partner, Lay, and I met him actually at the age of 18 and 19, and we wanted to get married and have children, and not to, he went and pursued law school while I pursued optometry school, but we wanted to start our family. And I figured with medical school, I'd be stuck in residency for so many years, I wouldn't be able to enjoy that work-life balance. So I made the decision of, I think eyes are really cool in the sense that if I look at a patient's eyes, not only are they the windows of the soul, but they're also the windows to our health. And I could actually tap in and let the patient know about certain parts of their health that maybe their primary care doctor never told them about. And I was fascinated about that. So I said, okay, great. I can actually treat the whole patient just by being their eye doctor and being a primary care eye doctor. And that's pretty much where I decided to start working for other eye doctors. I had some wonderful OD/MD practices I was part of during optometry school. And even when I was in Loyola, I investigated, researched and looked into becoming an eye doctor and what that would all be about. But I really chose a wonderful profession, and it's so awesome actually having you part of this community, this dry eye community, and you and Dr. Jenna, basically bringing us all together. I think collaboration is so key to growing and educating our patients. And it's really a wonderful thing to be able to spread the knowledge, and how you guys are tapping into nutrition. We definitely parallel you on that. Spending the extra time and kind of spacing our patients out to be able to get to know them, what ailments they have above and beyond just dry eyes, and how we are completely connected as a system. But diet is certainly so important to discuss. And I definitely grew up in a culture where that was really an important part of health. Yet in my Western training, it was discussed so very little. So it took both you and us to be able to research on our own, those things that would keep us healthy to get to our end goals, which for me, the biggest struggle in my life was to be able to have children. And ultimately, both you and I, we have our children now. So I have my Dahani on this side and my Kainoa on this side, and they're very special and honestly miracles to me. And I congratulate you because you have one on the way. So that's so exciting. So congratulations.
Exciting and nerve-wracking. We're 29 days away. So
yes.
by the time this comes out on YouTube, we'll have the baby. And by the time it's live on Facebook, so we have 29 days to go. So yeah, we went down a very similar journey of infertility for 3 years, following everything Western medicine had to offer, and nothing was working. And we just switched a little bit of our diet. We already ate a pretty healthy vegetarian diet to begin with, but we just switched a couple things, and then we pursued Eastern medicine, pregnant in 3 to 4 months. And so
That's beautiful. I love it. Yeah, we definitely had to choose a similar route, and it was basically an East meets West. And without the acupuncture and the naturopathy and the meditation and the herbs and all the things, supplements that I was taking, then that's how we were finally, able. We began with 13 embryos for IVF, and we ended up having 2 children. So they are truly our miracles, and we're so grateful and thankful to have them. So
that's great. Congratulations on that.
thank you.
So let's jump into the topic at hand, which is leaky gut, which the infertility journey took you down that route, took us down that route. So let's talk about just what leaky gut is first, and then we'll jump into ways that we can help it and how it relates to dry eye.
Sure. So basically, leaky gut is intestinal permeability where it shouldn't be. So many of us, we eat, a proper diet in the sense of like we try to incorporate our carbs, our proteins, our fats, eat vegetables. But sometimes what happens is due to the quality of our food, the soil, it's not the same. Basically, pesticides and glyphosate and GMOs that are in our diets can wreak havoc on our enterocytes, our gut cells. And what damage it does to the gut cells is it causes their tight junctions, their spaces that are supposed to be glued tight to one another, causes them to space out. And those tight junctions can allow for the passage of undigested food and pathogenic microorganisms to enter the bloodstream. And once that undigested food and pathogenic microorganisms enter the bloodstream, it can go anywhere in the body. It can go to the brain, it can go to the eye, it can go to the liver, it can go to the pancreas, wreaking havoc. So that's basically the definition of leaky gut, is when food, undigested food, and these pathogenic bacteria are seeping into an area where they shouldn't be. They should be going out the fecal matter, and instead they're entering within us. And that also causes poor absorption of our food. So I've had an array of patients. We do a test in our both of our offices called a biophotonic scan, and it measures a patient's carotenoid antioxidant level. And some of these patients swear, they're vegans, they're vegetarians, they eat so many fruits and vegetables. We have no idea why their score is so low. Initially, we had no idea why their score was so low. And we came to discover that it was actually because they were not absorbing their nutrients. So even if you eat something and you feel that you have an amazing diet, but we can't guarantee you're absorbing everything. And that's where, at least with the help of digestive enzymes, which we were about to talk about, I think, can at least help you to break down your food and into smaller particles. So breaking down the protein, breaking down the fats, breaking down the carbohydrates. So some people need help on that end. Maybe these patients don't have a gallbladder. Maybe they've had it removed, so they can't secrete the enzyme lipase. Or maybe they are in such a sympathetic, nervous system state. In other words, they're always in a flight or fight, go, go, go state, that they're unable to tap into their parasympathetic rest, digest, secrete mode. And part of kind of breathing before you eat or praying before you eat taps you a little bit into that mode so that you can salivate, create, get your digestive enzymes ready and eat your meal in a way that you can digest your meal. So part of our education is above and beyond what to eat, but it's also how to eat and what you might need to help you to digest your food. So that's
let me pause you there just to unpack a little bit of what you said, because you said a lot there. And
I always do. Sorry.
No, the first thing I want to reiterate to viewers is that the inside of your gut is just like your skin. So your skin is made to keep things out. It's a barrier to the inside of your body, and the inside of your gut is the same way. It is this barrier that's trying to prevent toxins and things that aren't supposed to be outside the gut. They're not supposed to be in your body. It's trying to keep it in there. But if we get cuts and scrapes in our skin, it's going to let toxins and anything in, bacteria. That's what's happening with a leaky gut. That's what the term is from, because now we have these tight junctions, like she talked about, broken up, and now things can just flow right through that aren't supposed to be flowing through, just like if you had cuts on your skin. So that's kind of what she was talking about with
Very good point.
The impermeability part versus the permeable part. And then going back to the digestive enzymes, this is actually a big problem that I've had. And I've been working with a functional medicine doctor for about a year and a half now on trying to get that up because my absorption was so low with all my nutrients, even though I ate a vegetarian diet. So I'm on a probiotic in the morning, but I also take a digestive enzyme with every meal. And that probiotic is also a prebiotic. So it's got a lot involved with that. But this is the importance of working with somebody that knows what they're doing, a functional medicine doctor, yourself with those tests that you're running. But when I get my blood drawn, it's not a simple thyroid panel or a cholesterol panel. He
Exactly.
every single nutrient.
Yes.
Try to find out where I'm missing nutrients and what I can do to help with that. So I just wanted to kind of unpack everything you've said so far, and let's keep going because this is great.
Right. I love that. I love your analogy. That's so important. And I do want to say that also the other cell in the gut that gets damaged is goblet cells. And you and I are familiar with goblet cells. They're mucin producing cells. And there's a certain coat that's applied to protect the gut. And when those are also damaged, now you don't have that protective layer. Now you have these spaces between the enterocytes or the gut cells. And so kind of double whammy where you get attacked by these pathogenic bacteria. So that's another part of the gut that gets damaged. So how do we treat leaky gut? One of the things that we wanted to, I guess, are we going into the
Yeah,
paleo?
no, I was just
Okay.
thinking, I was laughing because that's a loaded question, but let's do it.
Yeah, it's such a loaded question. I think it's best if I just throw it out there, and then you're so good about asking me questions. I appreciate that.
Yeah, let's do it.
So, okay, so typically I tell my patients that what I'd like them to do, since you potentially could do, and I mean, I've had so many different unusual bacteria. I mean, back to my story, I suffered from infertility. I had positive ANAs where they thought I had Sjogren's, ankylosing spondylitis. I had eczema. I had leaky, I'm going to call it leaky brain, because that's another thing that we can go into. But it's when, there's these pathogens are kind of leaking into your brain and causing mental confusion, anxiety, depression. Those are all real things. I mean, that's just not something that happened out of the blue. I really feel that if you fix your gut, you can actually help and fix your mental state. It definitely helped to fix my level of anxiety that I had growing up. But all of those things that I had, I needed to find a way to fix it. And I was given steroids and other Western remedies, maybe like they wanted to give me antidepressants. When I had sinus issues, because that's another pathogenic microorganisms can be, stuck up there. They wanted to give me sinus medication, all of that allergy medication, which, as you know, allergy medication also causes more dry eye. Antidepressant medication also causes more dry eye. Anti-anxiety medication, same thing. So now, how are we going to heal this? You could do blood tests. They get very expensive, and then you have to find out which bacteria is a culprit, and then take an antibiotic to kill off that bacteria. That's kind of not the way that I like to go. There is also something called fecal transplant, where they, I don't want to go into that because I don't do that. So that's another route. My most favorite route of healing this is so simple and so inexpensive. And it involves some of your time, between 1 to 4 months, and it involves a diet. So I'll start with what the regimen would be. And I appreciate as well that you mentioned that you take probiotics, and I like how you said I take them in the morning. So probiotics will absorb best on an empty stomach. So that's great that you take your probiotics in the morning. I honestly often take mine late at night, right by my toothbrush. So I remember I'm not eating. I've been eating for the past 3-4 hours. I'm going to take my probiotic, go to bed, because sometimes probiotics might cause some gas or some other issues. So sometimes it's nice to take them at night, but either in the morning or at night, as long as they're on the empty stomach. And thanks for letting me speak so candidly with you here. That's the best way to take them, so that you absorb those friendly bacteria. And one of my favorite other components to healthy bacteria is actually a friendly yeast called Saccharomyces boulardii. So I usually recommend our probiotic plus, which has 6 strands of bacteria and 1 strand of yeast to implant in the gut on an empty stomach. So one of those, let's say in the morning or at night, that's part of the regimen. And using what's called serum bovine immunoglobulin, or SBI powder. So it's a powder. You place it in water, or I also allow coconut water, mix it up, and you drink that every day. I prefer it to be drank with taken simultaneously with something called gastrohealth, which has amino acids in it that help to repair the enterocytes and the goblet cells. But in and of itself, step one, how are we going to fix the leaks between, the leaky gut? How are we going to repair those tight junctions, those spaces, bring them tightly connected to one another? That's part of it, and getting rid of the bacteria is another part. So to get rid of the bacteria, we drink the serum bovine immunoglobulin, and that's basically IgG derived from a cow. And a cow has 4 compartments to its stomach, much more knowledge and ability to locate all the pathogenic bacteria or microorganisms that don't belong in the gut better than we can. So we take a little bit of their IgG every morning, then this IgG is going to connect and find all the bad guys. It doesn't matter which one. It's just a general, kind of raid to find the bad guys and to not harm or touch the good ones. And so it connects itself, makes that microorganism bulkier. Now that it's bigger, it can't pass through the leaky gut anymore. It can't pass through those little tiny spaces between the enterocytes, and guess where it goes? Out the feces. So over a period of time, tagging them, catching them, removing them, tagging them, catching them, removing them, a month's worth, depending on the condition. Maybe patients have multiple ailments, multiple diseases, multiple autoimmune issues. You might be on something like this for 4 months, maybe just 1 month. Maybe you're just doing it to kind of clean out the gut, and then it's a shorter period of time. But that would be done for between 1 to 4 months. It really depends on your condition. Then how do we repair? So that's step one. So any questions about how to tag and remove these pathogenic bacteria?
No, that was perfect. I was just going to add something, but I think we're going to go into it. So I'm just going to let you keep going.
Oh, okay. Well, because step 2 is really important too. So now you've gotten yourself rid of all these pathogenic microorganisms. And so, but guess what's left over? The leaky gut is still there. The enterocytes didn't magically come together and heal at this point. They just don't have the bad bacteria anymore. But hopefully you are taking your probiotics every day throughout this period of time. And so this healthy bacteria and this healthy strand of yeast are implanting into those spaces and implanting into the lining. So that's one way. And the other is a powder called GastroHealth that's filled up with vitamins and amino acids to enter inside of each of the cells, help to reformulate the tight junctions. And so no longer are those enterocytes spaced out. They formulated their tight junctions together. The goblet cells are functioning properly, secreting mucin. So it's basically nurturing and healing those cells. And sometimes we even add colostrum as well to that. So it really kind of depends on the patient and the level of severity, but using the serum bovine immunoglobulin, the SBI powder, to get rid of the pathogenic microorganisms, undigested proteins, and secondly, repairing, sealing, and healing the enterocytes and goblet cells, that's part 2. And then implanting these beautiful bacteria and yeast back into the gut to work for you and help you to break down your foods and protect your gut. And that's step 3. So those are kind of the 3 different ways of healing and sealing and getting your leaky gut taken care of. So that's usually my patient response that I
love the approach, and I love everything that it just makes sense. But I wanted to add one more thing, that
Sure.
Your leaky gut came for a reason, and then we got to find out what that reason was and then get rid of that cause. And so
Absolutely,
a lot of people,
right. So this can reoccur. Absolutely. It's such a good point. So the other parts of this are, we simultaneously ask our patients to be on a paleo autoimmune diet. And the simplest way of describing this is, imagine yourself in the paleo era. Imagine yourself having to be a hunter, having to be a gatherer, having to pick fruits and vegetables from the ground, off the trees, hunting for your food, and then eating that. There wasn't farming then. There weren't grains. There wasn't breads and carbs and Coke and fast food and on any of that. There really wasn't alcoholic coffee, chocolate, things like that. So some patients definitely feel it's a very limiting diet, but if you focus on all the things you can have, all the awesome, amazing superfoods that you can have, then what you can't have, it's not as big of a deal. You just have to, retrain. You want something sweet, then it's going to be a fruit. If you're hungry, you want something salty, then you choose, a protein or a vegetable, and you can season. Sea salt is fine. Using garlic and spices are fine. Sometimes pepper and nightshades are not on that list though. So that diet is also key, like eating the proper way. I love that. So right now I'm doing intermittent fasting, so I haven't had anything this morning. You've probably had your green smoothie. I'm going to bet you $10 that you had that this morning, and that's great. You're alkalinizing your system. Sometimes I'll have water with apple cider vinegar or water with lemon in the morning, and I still didn't break my fast. So that's matcha tea is great too, right? Though they have antioxidants that build up our immune system. So some kind of teas, hydration. Our body is really thirsty in the morning. Oh, bone broth soup. That's one of my favorite breakfasts in the morning. I just, boil, soup bones, sometimes with meat as well for 24 hours, and then add whatever vegetables I want, carrots and onions and celery and garlic into that mix. And in the morning, I'll just drink that like a tea, just in a mug. That's just honestly one of the best breakfasts. But snacking on things, maybe pork rinds or seaweed chips, because they're not, high in sugar. So the sugar, for me, the sugar was a huge thing in my Loyola years. I was suffering. I gained 15 pounds. I had oral thrush. I eventually got giardia, which is a parasite. I mean, so many crazy things happened to me during those years that I stopped eating my mom and dad's Persian food. And I just decided I'm going to do my own thing and carve out and have, all these sweets that I was craving, and I kept craving them. And I didn't know why, but I tell my patients now, it's actually, you don't crave sugar. It's the yeast inside of you that craves the sugar. Yeah. So if we get rid of the yeast and we just stop the sugar, the yeast will die off eventually.
Yep.
So
yeah, I always tell patients that you're going to crave whatever you eat. And so if you eat a pizza every day, you're going to start craving pizza. If you eat candy every day, you're going to start craving candy. We had somebody post in the community about how she has to have 4 cans of Diet Coke every day. And it's not her that craves the cans of Coke, it's your gut. And so if you get rid of the Coke, it's going to be hard. But once you get rid of it and go through that 1 to 4 month protocol that you just talked about, you won't crave it anymore. I haven't had pop since I was in 6th grade, and it's just because I don't drink it, so I don't crave it. It's hard to get off of it, and I crave things like green smoothies and healthy vegetables. And a lot of people think I'm just a strict vegetarian, and I'm not. I'm all about whatever works for you. And so if you follow the paleo autoimmune protocol and it works for you, then stick with it. But I feel like me personally, I don't like to eat meat just because it doesn't react well in my system. And so that's why I don't eat it that often. I eat it probably once every 2 weeks or so. And so it's all about finding what works for you, and you can follow a vegetarian diet or the paleo autoimmune diet. But the key thing is just eliminating sugars, eliminating processed foods. Grains can be a good thing to try to eliminate first. And then if you like grains, you can try adding them back in later to see how they react to you. I know that wheat and gluten, I pretty much tell everybody they should stop eating wheat and gluten, just because I think 95% of people have some kind of allergy to wheat or gluten. I get eczema. I get rashes all over my face, or eczema as well. I get rosacea. I get dandruff. I get arthritis. That's all from wheat and gluten, because permeating my gut and getting into those areas that it's not supposed to be. And the days after I eat wheat and gluten, I have brain fog. I literally feel depressed, anxious. And so I have a pill now that if I really want wheat or gluten, I can take this pill and it helps me temporarily, but it eliminates that brain fog. But if I keep going with the wheat and gluten route, I will eventually get all my symptoms back again. The arthritis, the eczema, everything will come back. So I really love what you went over. Now I want to kind of switch gears a little bit and talk about something you kind of breezed over, which was meditation and prayer, and how important that actually is, and how important it is, because people don't realize how important it is. But just go into that just a little bit.
Yeah, I mean, I love like coming off of what you just talked about regarding like how well you're able to tap into your biofeedback and what your body needs as far as like what you crave in your food. And just to clarify, I do agree with you that like when I look at a plate for a patient, when I describe what they need to eat, I do want 80% fruits and vegetables and just 20% the protein and the meat. So we don't need that much, nor do we need it every day. So that's a really good point. And if we can choose non-GMO, because we don't want to keep entering these bad, pathogenic microorganisms. So you kind of have to choose quality versus quantity, and really go for good quality foods and shop at proper places that don't put those GMOs in their grocery stores, or have a select area where they don't have those GMOs in their grocery store. But yeah, so back to tapping into before we, I feel that we should talk about those two systems: parasympathetic, rest, digest, secrete; sympathetic, fight or flight. A lot of us right now, and even with the pandemic, there's been a lot of stress. There's been a lot of, we're kind of attacking our own immune systems because we're not breathing properly. We're not filling up our lungs. We're not oxygenating our body. It's not circulating in our blood supply. What are some ways that we can allow ourselves to, gain that oxygen? And part of it is when we just let our thoughts go and not think about anything. And that's what meditation is. I know there's a great Netflix series called Headspace. Basically, someone who became a monk and kind of guides you through it, where you can watch something and learn how to meditate. And it even calmed down my 4-year-old, just kind of watching me watch it. He was just mesmerized by the shapes and just staring. And I was watching how he was breathing, just these nice deep breaths. So we're looking at a fish tank where we lower our blood pressure just by watching and kind of letting go of our thoughts. So meditation is a huge part of healing, and sleep is a huge part of healing. Many of our patients, I have patients with corneal abrasions that don't heal, and I really don't know why until I ask them about their sleep, and they're like, oh, I only sleep 3 hours a night. Well, that's not going to cut it. I mean, we need to tap into that parasympathetic state. That happens during sleep. That happens during meditation. We start to have similar brain wavelengths in meditation as we do in sleep. So if we can, during an awake period of time, force ourselves to just relax our brain, relax our breathing, tap into our parasympathetic nervous system, then not only do our glands of our eyes secrete better, our meibomian glands, our lacrimal glands, we're all a complete connected system. So that is really a great point. And I love talking about meditation and yoga, because it forces you to breathe with every movement. And in the end, you get to do my favorite pose, Shavasana, where you're just laying there and breathing and enjoying all of the, goodness you just did for your body through that.
That's my
yoga
favorite pose as well. I probably usually fall asleep half the time, but it's just because I'm so deep in breath, right?
Right.
But yeah, I love the fact that I don't love the fact that we're chronically stressed, but taking time to meditate every morning. And a lot of people say, I'm too busy to meditate, or I'm too busy to pray. You're too busy not to pray. I mean, that's the time you need to slow down, because when you take that time to slow down first thing in the morning, it's going to make a huge difference later on in the day when your boss blows up at you, or you have that patient that blows up in your practice, or when that person cuts you off in the road. If you didn't take that time in the morning to meditate and pray, then you don't have that time to relax yourself, and you can control your emotions better and can handle those situations better when you take that time to just relax in the morning. And if you find yourself getting all stirred up, like with my son who's 3 years old, I'll step away and just take a couple deep breaths and then come back to the situation. And I'm a lot more clear-minded, and I won't do anything I'll regret later on or something. So meditation, prayer, really important. And I love that you said doing it before meals, because it really sets you up to digest, because the rest and digest system. So Dr. Golie,
and also before sleep, right? A lot of our patients need to do a little meditation, get off our phones, you guys, put that phone aside, either, meditate or read something, but just get off of those digital devices, because we have to clear our brains. We don't want to fill them up right before sleep. You actually want to clear your brain out and have a really good night's sleep. Yeah.
We recommend an hour of paperback books before bedtime with no electronics on.
Yes, I love it.
So anything else that you wanted to add to today's conversation? This was a great conversation that we had.
Thank you. Well, I would say, gosh, yeah, we talked about so many great things. I definitely feel that this is a period of time. I think this pandemic has caused a lot of doctors out there and patients to be stressed and to, kind of get frustrated with potentially their approach to how to take care of patients and whatnot. if we help our patients to help themselves, if we educate and keep educating our patients and talk about health and diet and nutrition and lifestyle changes and support them and ask them questions about their ailments from head to toe and how they're eating and what supplements they're taking and whether their sleep is good and what are the 5 things in life that they really love to do that keep their heart happy, that is another part of, having a great bedside manner as a doctor and connecting with your patient. Have the patient do the work. Actually, they want to do the work. They want to learn. They're searching on the internet to find natural remedies. And, why don't we help to support them? It just means that we as doctors have to educate ourselves and as colleagues come together. And that's why I love collaborating so much with you and other like-minded doctors. It's so great to have this community and this space that you've created with your wife, Dr. Jenna, bringing us all together. And it's just lovely to have and lovely to be a part of. So gratitude is part of happiness and being positive is part of healing. And so I'm really happy and positive and grateful to be here. And I look forward to, seeing you, meeting you, and working more with all of our colleagues and our patients in the future. So thank you.
Well, thank you for the kind words, and thanks for being a part of the community. Now, the viewers are probably dying to learn how they can get a hold of you. So where do you practice? What's your website? How can they schedule an appointment with you, either in person or with telehealth? So let us know your website as well.
Sure. Well, the easiest way to find or follow me is I do have a Facebook group, and it's basically Journey to Wellness with Dr. Golie. So it's open and you're welcome to join. I also have an Instagram, Nurturing the Soul underscore with Dr. Golie, Nurturing the Soul, and then underscore with Dr. Golie. So you can follow me there, or just find me under Dr. Golie under Instagram. It's my personal one. I'm happy to. Most of my patients actually have my cell number and my email. I can throw my email out. It's dr.golie@gmail.com. So dr.golie@gmail.com. Feel free to email me. I really feel, and living here in Honolulu right now, we're basically going back and forth between Chicago and Honolulu, that we are all one ohana, we are all one family. So I'm happy to help, and I'm grateful that you had me here on this Dry Eye show and we were able to do this video together. Thank you so much.
All right, Dr. Golie, thanks for being on the Dry Eye Show.